Good afternoon. I'm Mark Strong with Multi Radiance, the Global Director for Business Development. One of the wonderful parts of my work is to meet incredible clinicians working with animals. And today I'm with Dewi Bergman, and she is here at the Sporthorse Medical Diagnostic Centre in Hees, Netherlands. We're at the ISOP module, and she has a wealth of experience starting out as a physical therapist in the human world and then crossing over to animal physiotherapy. And she's going to tell us a bit about that process, but also the modalities that she has found are most relevant to her now in her practice. And one of those, of course, is, reaching for it, the Multi Radiance laser. So, if you will, tell us, for the audience that doesn't know you, you're very well known here in Europe. If you will, tell the audience, please, a little bit more about yourself, your work, your background, and how you got to where you are today.
Okay, thank you. So my name is Dewi, and I started out as a human physiotherapist 20 years ago. In the Netherlands, it is required to become a human physiotherapist first, and then you can do the specialization in animals. The human education is a 4-year education, and then after that the specialization is 2 years. When I started as a human physiotherapist, I worked for a couple of years in the human field, which was for me very interesting because it gave me the opportunity to work with all kinds of patients, with all kinds of injuries and problems going on. And I worked at a private practice and also at a rehabilitation center. And that last thing was exceptionally interesting for me because I learned to work there with people that lost their speech. And that is quite similar to work with animals. And you had to really go outside the box in ways of communicating, and you had to rely very much on your touch and on your observations. So for me that was very important in the first part of my career. And from there I went to specializing on horses. And because I wanted to know more, especially about spinal issues in horses, because that is something that we see very often, I also specialized in chiropractic, and that was a 2-year extra education here in the Netherlands.
So you had an education very different from the typical veterinarian, going to school and learning surgery, learning about drugs. Of course, the programming is sponsored by the instrument companies and by the drug companies, so it's no surprise you're getting a lot of knowledge about that. But from your vantage point, you're learning about things with your hands and with your eyes and a much more connectedness to these animals, especially when you're looking at your experience with humans who can't really communicate with you with voice. And as you've discovered, and I've witnessed, horses can be so incredibly, wonderfully sensitive and expressive and letting us know if we will just tune in. And I always introduce myself to a horse. I let them have a smell of me because that's what they want. They're a prey animal. So they want to know, is this person okay? And they sense your energy. And so this has been such a fun time for us because we bring this science of using wavelengths of light and static magnetics and very natural forms of working with cellular biology. And so you, looking for things that you can use most efficiently in your practice, at some point you started looking into modalities like laser and other things. But you came across our lasers thanks to your husband, with Eric, and probably at an ISOP conference originally.
Yeah, true.
How did that get started? How did that work out?
So at first I was a little bit hesitant to use modalities because that is something that is not used as often anymore in human practice. So there was a trend that was going on. Physical therapy was a bit more focused on manual therapy and on exercise therapy, and modalities were a little bit old-fashioned. But I think it's about 10 years ago that it started to come back a little bit more into equine praxis, and I stumbled across it due to Eric buying some of the machines from you with the idea in mind that we could rent them out to clients. And I once in a while I used it as well, but not so very often, because also our therapy is much more focused on manual therapy and chiropractic. And then I went to the Olympic Games in Rio de Janeiro, where I was part of the physical therapy team, and laser was quite often used over there. And I think there my interest was growing, because I've seen there how we worked with the laser, in a high pressure environment with high level sport horses, and they reacted very, very well to the treatment. And it was essential in that way, that normally if I do manual therapy, there can occur some soreness afterwards, and that is something that you cannot use in the setting of high level performance in a competition period of time. So for me it was very nice to see that if you do your therapy and you combine this with laser therapy, that the soreness afterwards was not there. And I treated mainly trigger points, fascia, and I had really good results with that. So that's where I think my interest was growing into this laser. And there were other colleagues that used different types of laser, because the class 4 laser was also getting a little bit of a hype. But I think what was really big advantage of this particular laser is that it doesn't cause any harm, because there's no risk of overheating of the tissue, and I think that is one of the biggest benefits of this particular laser. And you still have like the super effect of a high intensity laser, but without the risks.
Yeah. One of the most important things we learned through our research was that photobiomodulation is a non-thermal process. It's photochemical, it's photophysical, but it does not require heat. It's the photons that really work the magic. So when you applied a laser to one of these horses that could be feeling a lot of anxiety, and of course being transported halfway across the world in many cases, they're tight, they're stocked up. Did you observe the physical changes in the horse when you started using the laser on them, like with the unwind protocol? Did you see their response, and how do they respond when you're using our laser with them?
Yeah, well, normally I already want the horse to be quite relaxed before I start. So I take my time to get them a little bit relaxed before I do anything with them. And then I start with some manual things like a little bit massage, and I do my testings. Of course, I want to examine the horse first before I do any kind of therapy, because I want to know what is going on, what would need some treatment. And then when I start with the treatment, then of course I start with the unwinding process, and you can see the horses get some extra relaxation from that. And they start to like chew and lick and be really at ease.
Right, perfect. Well, this has been the kind of experience that clinicians are having all over the world. It's very well received. It's not something that causes them any anxiety. It relaxes them, it improves their blood flow. It gives them a release of endorphins, so they get that systemic response, which is so helpful. And that's why it has caught on so much in so many different parts of the world in a high pressure environment where you need to keep this horse at its top condition. And now we've done a lot of studies to show that it's a pre-event tool, a pre-event conditioning tool, and a post-event recovery tool as well. In fact, some are saying to us that the chiropractic is easier if they laser first because it's relaxing the muscles, and same way with the massage, and same way with acupuncture, now of course laser puncture. Now that we've discovered that lasers can give a very effective type of relief like the needles without using a needle, because after all the body is fascia, it's made of collagen and water, it's very transmissive to biophotons, and vets like Dr. Alan Schoen at Cornell did a lot of investigating in this area to explain acupuncture to the Western mind, which is anatomy based, rather than the fire, the wood, and the chi that is very accepted in China with 4,000 years of experience, but totally not understood by the Western mind. So this translation of terminology, translation of techniques is so important, and you're experiencing something similar in your world with vets not understanding your language, and you have to learn a common language between each other so that you can best approach a horse and say, okay, now we know what we're talking about. Because you come from biomechanics and all things as a physical therapist, and they're coming from drugs and surgery and all the things that they learned at whatever vet school they went to, which has a lot of variation, just like the physical therapy courses.
Sure.
So today, it seems that vets are feeling less parochial, less territorial, and appreciating your skill set as adding to theirs for the ultimate benefit of the horse.
Absolutely.
And I'm sure that as clients, horse owners, riders, they want to see this kind of collaboration because they just want the best of whatever's available to give them the best response for their horse to be as fast and as completely healed as possible. So now we're seeing this wonderful collaboration, and you're seeing less resistance, more acceptance among these young vets. This, of course, is the way to go. It makes perfect sense.
Absolutely. Yeah, I think that nowadays it's totally accepted, especially here in the Netherlands. I think it's even strange if you're a horse owner and you don't have a team of people surrounding you, helping you with the management of your horse. So yes, I think equine physiotherapy is now totally accepted, as well as in the veterinary field, as in the as for the horse owners themselves. Mm-hmm. Yeah.
And likewise, with the benefits of laser therapy and what it can do. And when you started wanting to help your horse owners or your riders, you started loaning out your lasers, which was a big step, something we've encouraged from the beginning. But of course, vets have, oh my God, I can think of so-and-so and so-and-so. And I go, wait a minute, think about the other end of the scale. You have at least 10% of your clients who are very responsible people. And so you gravitated to them. And how was that experience when you were first lending out the laser? How did that work? Was that well accepted? Did they appreciate that?
Immediately.
Immediately.
Yeah. I think the clients that we have, and I think we're maybe even a little bit spoiled by that, because we have clients that are really open for everything that we can do to improve their horse's health. And laser is one of the things that we can offer. And I think it all depends on how you explain what it can do and how they should apply it, and then they're super happy with it. Mm-hmm.
So now in this new world of communication with social platforms, we have this new, not new anymore, but this ability to do podcasts. The ability of how we're sitting here today, having a conversation and sharing our experiences, and this whole collaborative environment is so enhanced by these podcasts where we can sit here and talk about this. And to me, it's so much more alive and dynamic than a webinar where you have slides and a disembodied voice. But we can have this sharing of compassion for the horses and the passion we have for our experience and our knowledge for how they can best be benefited. So it would appear to me that your brand, the Sporthorse Medical Diagnostic Centre, has a very bright future with educational podcasts, because there's a content that's going to be very relevant to your riders, very relevant to the physiotherapists, and very relevant to the veterinarians about how you are continuing to lead the way into this more collaborative environment. And it would seem like a podcast just on terminology to help these physiotherapists and vets better understand each other might be a good topic as well. Do you see the possibilities for your brand to have a series of different educational podcasts? Does this seem like it's relevant for you?
I think so. It could be. The thing is that you have to find time, and that is always difficult when you're working in the equine field.
Of course.
But I absolutely see the benefits, and I think that's the future, because it's an easy way to reach a big audience. And I think the way we are working at SMDC is to spread knowledge and to spread and to exchange our experiences in different types of treatment. And I think this could be a way to educate. Yeah, absolutely.
Wonderful. Well, just like laser has gained a tremendous amount of acceptance over the last 10 years since I started, because back in 2010, more than 10 years now, vets would commonly ask me, do you have any studies? I don't know anything about this laser therapy. I know what I do with surgery. And so we had to accept the challenge to invest a lot of money in peer-reviewed, gold standard, controlled research to give the kind of evidence that vets would require. And likewise, you've gone through your trial by fire, showing vets that you had a skill set that would be very beneficial for the horse and ultimately for them to be seen as someone who's collaborating for the best possible outcome. Do you see the use of laser continuing to grow as you look into the future with your business plans and your clinical plans and so on? Do you see laser maintaining its relevance or growing in relevance for the kinds of conditions it can treat?
Yeah, at least maintain, but maybe even grow. We see at our clinic that it grows. Because, yeah, I think also through experience, you start to see more, how you say that?
Evidence, outcomes?
No, I mean, I can't find the words. How you say that when you, no.
Acceptance, experience?
No. Yeah. I know the word, I can't find it. Let's do that question over again.
Do you see laser growing in use as a modality for your horses and in service to this collaboration between physical therapists and veterinarians in the horse industry? Like for Altana's example.
Okay. Yeah, I think laser has a future, of course, because we see the effects and we see that horses benefit from it. So yes, physiotherapy in general is also growing. So I think laser is going to grow with it. And it is already, I think, well known within the veterinary field that laser is something that you can apply. But I think not enough people know how it exactly works, why it works, and what the indications exactly are. So I think there is still some education to do, and with that, it will grow.
Well, it sounds like we need to do more podcasts and more educational podcasts and make those available to you for your clients.
Yeah.
So that together we're stirring this pot of knowledge so that the best of it can come to the top and be the most useful for people.
True. And I also think not only laser in general, but especially your type of laser, which is actually different from the other ones. And not a lot of people know that. And because it looks like a very simple device, the people don't always know that this is so powerful. Because it's really small, it's handheld, it cannot be really much. Well, actually it is.
Yeah. I remember back in 2010 at the World Equestrian Games, and after Dr. Kent Allen and the head of physical therapy, Mimi Porter, who to us was like a goddess. Can you come over just this way a little? We're out of the screen. Thank you. But at the end of the games, I said, okay, well, what do you think about the experience that you've had? It's been 10 days, 72 countries, dawn until dark every day. And Mimi was talking and she said, I found this to be incredibly useful. We had muscle tears, edema, pain, but we never had a pain provocation. And it was not something heavy for me to carry around. I loved that I could put it in my pocket and not have some big heavy thing to lug around all the time.
Yeah. Because what is also very important, I think, to mention is that it's FEI approved.
Yes. And one of the things she said was, and it's got plenty of power. It seems that it's got the power to reach those deep tissues.
Yeah.
And that's when Dr. Ken Allen took the laser from her and he said, well, we were very intrigued by this because it was so small and worked so well. But the secret of that is true superpulsing, something that we spent a lot of time investigating to find out that heat was not necessary and was not even part of the definition of photobiomodulation. That is a photochemical, photophysical process, but it's not photothermal. Well, this was huge because the problem with laser adoption and not being accepted by FEI ever because the potential was there to burn skin or damage eyes. So not approved, period, the end. And you'd never imagine renting it out to a client and taking a chance like that because ignorance is not an excuse if somebody were to get harmed. So the true super pulsing means that there's a very high peak power pulse, 50 watts in the case of our Pro, 200 watts in the case of our laser shower. But the super pulses are of such short durations, nanosecond pulses, so fast, billionths of seconds, there's no heat generation. So you can't have a thermal overloading of the tissue. Once people understand that, and they can wrap their arms around the fact that we changed the semiconductor. It's gallium arsenide, it's not gallium aluminum arsenide. That's why we're putting out these high peak power pulses, and that's why they're so short, and that's the secret to getting rid of the heat. They go, wait a minute, Sounds perfect. You're unlocking the abilities of lasers to be used anywhere. And because it's not a continuous way of generating heat, you don't need a heat sink, you don't need all this other stuff. But what you do have is a lithium battery in here that can last for a week.
Yeah.
So they love the fact that they can put it in their pocket, but they can take it literally anywhere. I have vets working with elephants in northern Thailand and Ceylon and Bhutan with different wildlife organizations. And for them, it's a godsend because they don't have electricity out there. They don't have Wi-Fi out there. But they can use this laser with really traumatic injuries. We've had elephants with abscesses and a horse that was hit by a truck and a yak that self-amputated because it got tangled up in a fence, and horrific wounds that could be healed because we also added a bactericidal blue wavelength, which was so helpful fighting because we've got all these drug resistance problems now. And your horses are so well taken care of, you're less likely to see a complicated infection. But in other parts of the world, it's not the case. They don't get the high level of care. But here you can see infection, and it's so important, I'm sure for you too, to be able to catch it early and prevent the infection, which is why the blue wavelength is so good because it's bactericidal. So understanding superpulsing is not just a gate, it turns it on and off, cute, no, that doesn't work. We've had physicists look at that and say, oh, that doesn't make any difference. So it's true superpulsing, which is the high peak power and the very short durations.
Yeah.
So as people learn about this, then there's a high level of acceptance because then you start thinking, well, if that's the case, why would I want to buy something that could obviously cause harm, something I can't take to these events? It's the same in the agility dog world and the professional training world. It's the same in the human athletic sports world where they want to take it when they go on the road to play a game. So the portability has been a massive factor for us. And then we have the different probes that go with it and a very comprehensive support program to give you the education that you need, to get the best out of the protocols. In fact, we're enhancing all of our manuals right now to make them even more relevant to what we've learned over the last 10 years.
Yeah.
So, any last comments? I really appreciate you being with me today.
Okay. I have just one question.
Please.
Because do you ever receive any critic for the fact that you are actually the only one with this project, but then also the only one with the research behind the project?
Well, that's an interesting two-part question. Of course, there are people, mainly our competition, or people who have been drinking Kool-Aid from our competition, who want to say, how can this possibly work? Well, they're told, of course, that nothing small could possibly work. So they have to take a bit of a deep dive to understand, well, what is photobiomodulation? What is truly laser therapy? And you have to be willing to accept that the science has been there for years now to prove that there is this biphasic dose response that says all laser starts out stimulatory but becomes inhibitory because of the size of the dose and the intensity. And so obviously if you're delivering a continuous wave, a lot of energy, then the skin can heat up, and that's going to prevent photons from getting through the skin. And you're not going to hit the target tissues as well as you would if there wasn't heat involved. And the super pulsing is really what's helping to facilitate getting the photons through. So once they see the amount of research, because we accepted the challenge, we said, there's no way we're going to convince the world without some pretty rock solid evidence. And so we're privileged to have Dr. Ernesto Cesar Pinto Leal Jr., who's been on the board of directors with the World Association of Laser Therapy. His Google citations, we invite anybody to just look up Ernesto Leal on Google citations and see, oh my God, look at all these studies, but look how many times the studies are cited. So when you're a science-based company, you want to talk about the citations because that means the data was credible, the quality of the data, because other people are using his work to reference theirs. That's the true measure of whether a study is any good or not. Are other people using that data because it was so good? So having a top researcher, having an abundance of papers that are now published in top studies, including our equine study in the Equine Journal of Veterinary Science, where we took 12 horses of very different colors, from white to black, every shade of gray in between. And then there's the ultimate, because if you take skin off of a horse or any animal, you've completely changed everything. The electromagnetic, the circulation, energetic principles, everything. So we took the ultimate challenge. We said, okay, a double thickness of cervical skin. We're going to have a sensor to measure the amount of light that can get through not just one layer, but 2 layers of skin. So unlike a jewel, which is a watt on the surface, we're going to measure it through 2 layers of skin. We had 10 times more energy through a double thickness of skin as with a class 4. We had no difference in the pigmentation in terms of the ability to transit through it because there's not a heat. It's not going to be reflected from white skin. It's not going to be sucked into black skin. And this is really important in the world of human athletics because we have very darkly pigmented athletes.
Yeah.
We have athletes with very darkly pigmented tattoos, and they can't participate in those studies with a class 4 because it heats up real fast. Oh. And when you have a 280-pound, 350-pound lineman in football, and he's looking at you like, what the heck are you doing? This is really hot, okay? You don't want to do that. So superpulsing eliminated the hazardous part, unlocked all the benefits. So we say, okay, can we show you the science? And if you're willing to just take a little bit of a look at the science and understand the definition of photobiomodulation, that's part 1. That's the science. Now, we can balance that with the clinical outcomes. We're going to show you a lot of cases. We're going to show you top key opinion leaders, but now we're working with key industry leaders like yourself with physiotherapy, people who have been using it in the field for, in your case, about 9 years now. Can it be safely said that 9 years is a pretty good experience and enough data to qualify as reliable? Yes. I have a lot of people in my 10-year club now, and that's my privilege as working with this company for 14 years. But few people argue, oh, no, 10 years is not enough. 10 years, thousands of cases. No, that's not enough. That's not logical. So having the balance of evidence with the outcomes, this is what people appreciate. And then it's people like yourself who are willing to say, yes, I'll speak up for this because I use it.
Absolutely.
My clients love it.
Yeah.
So that kind of puts a bow, a cherry, and the sprinkled sugar on top to complete our picture today of why Dewi Bergman finds this laser of great value in your practice, why you're willing to talk out to other people about it, why you see a great future for laser, and why it's going to be, and perhaps even expanded in the number of units being used here.
Yeah, I think
it's quite possible. Yeah.
Yeah.
So we love our partnership with ICELP. We love our partnership with the Sporthorse Medical Diagnostic Centre. And we love the fact we're humans. We still stumble over words occasionally.
Yep.
But it's really a pleasure talking with you today. And we thank you because we know you are very busy. So thank you for your time. I'm going to thank your husband. He's been so great. He's been such a gracious host. I've seen him in so many environments now. He's always got a smile for everybody. He's always making contact with everybody. He's kind of the perfect person to host events like this that people really find useful for the content, and the environment is very conducive to learning.
I would like to add to that we do it as a team.
Well, you do, of course.
And of course, my husband plays a big role in it, but it's actually a team effort to host an event like this. And also in our daily work, it is at SMDC very much about our team.
Well, we couldn't agree more. It always is about a team. We know that internally, and just as a wild guess, besides the catering team, which is a whole team unto itself for the job they've done, which is fantastic, how many people are now working at your Sporthorse Medical Diagnostic Centre?
I think we're around 18 people now.
18 people. That's pretty good, because this is recognized as one of the top equine hospitals in Europe. You certainly have a fantastic facility here. So if you're a horse owner in Europe, you want to know about this place. And if you're interested in physiotherapy and modalities and collaboration with vets, if you're a vet, you want to know people like Dewi Bergman. And if you're a physical therapist, you want to know people like Dewi Bergman, because it's this collaboration which makes us all stronger, makes the team stronger, because we're all here for one big reason. We want to do the best thing for the horse. That means fewer drugs. We try to prevent surgeries that might not be necessary, because for us, it's all about catching it early. Catch something in the acute phase and maybe prevent it from getting chronic, especially things like arthritis. Racehorses started at 2 years old. They're not even finished growing yet. And scar tissue can be obviated in a lot of cases by having revascularization. And so people like yourself who are very observant can feel and understand where there's a problem, can approach it quickly, and really help tackle it and address it before it becomes serious. So again, thank you very much. Thank you very much for your time today. And thank you all. We hope you appreciated this. Let us know at multiradiance.com. If you're a practitioner and you have a subject you'd like to talk to us about, you can reach us very easily at info@multiradiance.com or jmarkstrong@multiradiance.com or Dewi at
DD Physio.com.
Sorry again, please.
Dewi at DD minus
dash
physio.com.
Great. Sorry to catch you there. Great. Get in touch with us for more information. We're always here to help. Thank you all very, very much.
Bye.